Hello, and thank you for joining me. This is Amanda with the HMIS team, and we're here today to talk about the revised HMIS data standards. These are the revised data standards as they relate to emergency shelters, street outreach, and safe haven type projects. So hopefully everybody is in the right place, and those are the types of projects that you're here to learn about. But if there are any questions after this webinar, we will definitely follow up, and we can do so through the help desk. So again, thank you all for being here. And I am recording this session, so it will be posted on our help desk, so it's available for users that were not able to be here in person. So we are looking at data standards changes that have already gone into effect. Their effective date was October 1st, so that was Saturday. And the big changes that we're going to see are around chronic homelessness, gender has some changes, and disabling condition, and health insurance. That's what we're going to focus on. So let's look a little bit more at what we're going to talk about. And we're going to talk about the difference between the changes in our universal data elements and those that are considered program-specific data elements. These are changes that come straight from the HMIS data standards, specifically the data manual. And that's a document that's available online that's provided to us by the federal government. It's on the HUD exchange, so it is supported by HUD, but it is a document that reflects a collaboration across our federal partners. And those federal partners are HUD, the VA, Health and Human Services, and even locally, the City of Chicago has adopted those as well and follows those for their programs as required data collection. And so these are the things that we're going to focus on that have changed in that manual. The biggest change is going to be around chronic homelessness. And there's actually a new data element that we'll talk about. The new data element is actually 3.917A. That's the particular one that will be used for your program type, specifically street outreach, emergency shelters, and safe havens. So we'll look at that in detail, and we'll quickly look at the change to gender that you'll find, which is simply a change in the pick list values that are available. Disabling condition has also had a change where there's actually now a requirement that all clients have this information collected about them. And under program-specific data elements, we also have a new pick list value, two new pick list values that have appeared under health insurance. So let's look at that a little more closely. And we're going to start by talking here about what does this mean to your programs and what impact it will have. The biggest thing to be aware of, and this has actually already gone into effect, there are actually new and revised questions already that appear on your entry assessments. And our team spent the last few days really making that you're all seeing the correct assessments. And we are 99% done with rolling out those new assessments. So all of you that are on this webinar should already be seeing them once you go in the system. And those are new 2016 assessments is really the big difference you'll see right away. But this also implies that your intake forms may not yet be completely, or may be out of date now, basically, because now that we've updated some of the available options in the system, you may find that you also have to add those options to your intake form. Do be aware that data has already actually been mapped over from the existing answers in the system for these values. So specifically, we'll look at how that worked with gender, and then also talk about how that worked with chronic homelessness. And I will mention, because I forgot to mention this before, that if you have questions as we're going through the webinar, do make sure that you let me know and type those questions in for me through the chat, or I'm sorry, the question function. I'm not going to use the chat function if we don't have to today, but I would definitely encourage you to type in your questions through the question function on the webinar. Also note that under handouts, you do have something you can download, and that's these exact slides that we're walking through right now. They are available as a PDF for you to pull down from the webinar menu options as well. So let's look at the actual changes that have happened under gender. So with gender, this is considered data element 3.6, and what's happened is the option of other has simply been replaced with a new option that doesn't identify as male, female, or transgender. So that was just a straight changeover, meaning that any client in the system that had the value of other identified now doesn't identify as male, female, or transgender as the option that you'll see for that question. So this is directly mapped over. This has already happened. and there's no longer going to be a field for you to type in what the other value was because it's not necessary anymore. So we'll talk now about disabling condition, but let me know if this raises any immediate questions. With disabling condition, it is simply as simple as all clients now needing to have this information collected about them, whereas before it was not, it wasn't all clients previously, but now it is. So if you hadn't already been in the habit of collecting this information for all clients, you may choose to start doing so to be in alignment with this new expectation. And we're going to move now into the next easy one here, health insurance. We immediately have seen a change already in our system, and you'll definitely see it in the new assessments as well, that there are 2 new pick list values available now to us under health insurance. And those values are Indian Health Services Program and other. So we have, there's been the addition of a value of other under health insurance. So with that, there's also a space now for you to specify what that other source is, if that's needed. So those are the simple changes, and now we're going to head into the chronic homelessness changes. And once we're done talking about this in the database, we will go look at it once we're done talking about this through the slides and breaking down the data elements from the data standards, we will switch gears and go look at the database directly to look at how all of these things now appear to us in HMIS. So data element 3.917A is considered living situation. And what we're going to see here is that there's been some, hopefully we'll all think of this as an improvement upon the way that we collect chronic homelessness data about our clients, because we've actually seen some combining of things, questions that were previously separated out. So we're going to look at this in great detail here in these next couple slides. But one thing to note here that the data standards do lay out clearly is listed on the screen here for you. With documentation of sort of validating the answers is not necessary for HMIS documentation in terms of answering the questions in the database. It is not required that you have physical documentation in sort of paper form to back up all of the responses. So just be aware of that as we go through this. That's been the way that it works for these questions all along, so that has not changed. So this is what the data element itself actually looks like, 3.917A. And this is, as it says here, for persons that are entering at HMIS project types of street outreach, emergency shelter, and safe haven. So what we're doing, there's a rationale here to explain why we're doing this. Some collection points to clarify when this information is meant to be collected about the client, and that informs which assessments these questions show up on, the collection points. The subjects is who this is required for, and then some instructions. So we are, in terms of the rationale, doing answering these questions to identify where that person was staying and the length of time just prior to entering your program. So this is about where you slept last night before you came into my program. So let me know if this raises questions immediately, but let's check out what this looks like now in the database. So as you probably recall, there were a series of questions before for chronic homelessness, and that's still the case. But now we're seeing that current residence living situation and length of stay have just been combined into the chronic homeless series of questions. So we no longer have 2 sections where we answer these questions separately. Now they are together. So we can compare to how this used to look when we go into the database, but this is the structure that we'll see. So we're now going to actually break down each one of these questions from the data standards to see the intention behind them before we flip over to looking at these directly in HMIS. So we're going to start with the first question, current residence living situation. And this is the text from the data standards to help us understand this, the intention behind and the structure of this question. And so we are again talking about the place that the client was residing just prior to entering the program. But the big change we're going to see in this question is that there's actually been headers added in to divide up the living situations into 3 categories. There's homeless categories or homeless situations, and then there's going to be institutional situations, and transitional and permanent housing situations. So those are going to be the three headers that the options will fall under. And let's look at what that's going to look like. So this list is already set up in the system. So in the last couple of days, you've already been seeing this if you've been in a client record looking at this question. And notice those headings of homeless situation, institutional situation, and then that transitional and permanent housing situation, and then the options that fall under them. So there's also a new term that shows up in here. Interim housing in this respect is actually an HMIS term. It's a new term to us, and it's actually nationally a term that federal partners have agreed to introduce for HMIS. Now, this is something that is potentially going to be a little confusing for us in Chicago, because we actually have interim housing as a program type, or project type, but this use of the word interim housing is not referring to an actual project type. So we did want to make sure this was something we emphasized, that we need to keep working on making sure this is clear to all of us of what this term is really meant to be used for when you're talking about this question of current residence living situation. So I'm going to go into the next slide to show you the actual HMIS definition of what this interim housing term refers to. But just be very clear that this does not refer to interim housing as we know it in Chicago in terms of a housing project. This is different. So what is it? Well, I've tried to bold and put in red here what this is describing for us, but this is not a type of housing, but more so a situation that a chronically homeless person may find themselves in when they are already they've already been accepted into a permanent housing program, and that unit is reserved for them, but there's some reason that they can't move in right away. And there's some examples here for you of the apartments getting painted, or the units, they just have to wait for someone else to move out or for it to get cleaned up, something like that. So in those cases, it's been determined that it could be necessary to use this term interim housing to allow that client to move temporarily into something like transitional housing while they are waiting for that permanent housing to become available, or to be made available to them, because they already have it reserved for them. They're just waiting to get into it. They're in this interim housing situation. So that's very different to be in an interim housing situation than it is to be enrolled in an actual interim housing program in Chicago. The end of this definition here I do think is helpful too, that by doing this, having this term available, it will enable that individual or household to be identified still as chronically homeless when they are brought into the permanent housing program. So this in essence allows the client to stay in a place so that they have somewhere to sleep before they can get into their permanent housing unit, but not end up on the streets because they can't go into transitional housing, because that could mean that they lose their chronic homeless status. So it just alleviates some of that burden that perhaps some clients have experienced in trying to get to their PSH unit. So that, I think, is something, again, that's very particular. And how does it differ from what we know of as transitional housing, or I'm sorry, interim housing in Chicago? And let's look at that here. Here's our sort of brief explanation of why this is so different. Because for us in Chicago, this is a program or a project type, and it only exists here. So that's why it was even an available term to use in these HMIS data standards. So this could be tricky, but just keeping this in mind, that there's a logic to why you would use that option for where someone was staying before they came to your program, and really think about when and why that would ever be appropriate for your program. So we will certainly be available to help people think through this, and we're still thinking through it, but we'll definitely let you know as we have more information to share. So that was the first question, the current residence living situation. Be aware of those new headers, and we'll see those again in the HMIS database very shortly here. But the next question, length of stay in previous place. We do have a different set of options here. A few of them have changed, like 2 to 6 nights is different. That's a new option for us. as well as 1 month or more but less than 90 days, and 90 days or more but less than 1 year. So there's some new terms in this pick list as well to define how long the person would have been staying in that situation that they just came from into your program. In the case of street outreach, this may very well be where they currently are and how long they've been there. Despite your program not offering them housing, they're still coming to you from somewhere, whether they're currently there or previously were there. That question is meant to be interpreted for both project types. So let's look at the next question here. This one leads into approximate date homelessness started, a slight rewording of this date question. And we are looking to actually do a look back with the client to the last time that they had a safe place to sleep or somewhere that was not a homeless situation. So that's what this date is meant to represent, is actually the last time that they were, the day after basically, the last time they were able to sleep somewhere safe. So when did this homeless situation start? And there's some things that can be included in this look back period. And let's look at what those are. So these breaks and institutional stays, if a client has been homeless for a year, but they can recall sleeping at a friend's house or a relative's house for a few nights in the winter, you might want to ask that client, instead of saying, okay, that's the date right before you stayed with your friend is when this homelessness started, think about how long they actually, and think with the client about how long they actually stayed in that place. Because if it was only 2 nights, if it was only a weekend, if it was less than 7 nights, you can go before then if they were also homeless before then. Same thing applies with institutional stays, that if the client was in an institutional setting like jail, substance abuse, a hospital, something like that, but it was less than 90 days, and they were homeless before they went into the institution and exited that place to homelessness as well, then that can also be included if you keep going back. You can keep going before that to get to this date. So those are the 2 exceptions of breaks and institutional stays that can be included, meaning your date can go before them. But generally what you're trying to confirm here is whether the client, like how long has their homeless experience really been, how far back does it really go? Because the way it works with chronic homelessness is you need 12 months of homelessness. And this question kind of gets at whether you've been chronically homeless for a year continuously. But we're going to look at the next 2 questions too that help us determine if the client has been homeless 4 times or more in the prior 3 years that equals 12 months. So let's look at the next question here. This one goes into how many times in the past 3 years they have actually been homeless. So this is meant to be used such that if this is the first time that the client has been homeless in the past 3 years, you would use 1 time. And you are trying to go back with the client to really figure out in the past 3 years, how many times have you been homeless where there's been more than a week. It really comes down to more than 7 nights in between those homeless situations, so that we can add them up to 4. And we're going to look at the next question here that jumps into the total number of months. So now we're getting at, does this person meet that criteria of all of those homeless situations equaling out to 12 months total, whether they were consecutive in a row or they were broken out in 4 separate times in 3 years. So with this, we are actually looking to add these up so that they are cumulative and not so much consecutive. And the next slide here will show us a little bit more about how to think about these numbers. So for 1 month, again, that means in the past 3 years, this is the first month that the client has been in a homeless situation or on the streets in emergency shelter or safe haven. And between 2 to 12 months, again, that's meant to be cumulative, such that if a client was homeless since January and it's now March, that would be 3, but then you add in another month if they also can recall being homeless back in October. So cumulative here. And for the next slide, we're going to actually talk a little bit about data mapping, and then we're going to go into the database and see what this looks like. So all of this information that we've just discussed is meant to be collected as a project entry, and in particular, chronic homelessness is meant to be collected at project entry. So therefore, anyone that was actively enrolled as of 9/29 will have that data mapped over from the previous questions if there were differences with like the pick list and so forth. That data will map over to the new set of questions, or if there was just the name of the date field, that will seamlessly transfer over. So data should map over, and the date that the mapping occurred was 9/29/16. So data that's been entered since then may have to be re-entered if it wasn't put into the new assessment for chronic homelessness. So let's look at how this looks in the database. And I'm just going to get myself logged in here. I don't see any questions yet, but if you think of any, do let me know. Here we go. So let me pull my screen over for you, and I'm going to go ahead into Client Point here, and I'm going to find a client record. And I'm going to look at my record here, close out this note that just popped open. And I want to actually go into one of these entry assessments here. I'm going to open it up. And notice that the available options for assessments has been reduced. You might have had more assessments available before, but we've gone ahead and made sure that we took away the things that you no longer need to have available under Select an Assessment. If you have any questions, concerns about what you're seeing, please reach out to the help desk by emailing us, and I'll put that email address up at the end of this. But we want to know if there's anything that doesn't look right to you. We did try to make it such that you maintained access to the 2015 version of the assessment, but I don't actually see that one listed here for me. So you actually should be able to see the 2015 version. Oh, my session has been lost. I'm going to have to log back in. And the 2016 version in case you had questions. But I'm going to log myself back in here. Okay, I'm going to go back to that client record. And here we go. Okay, I'm going to go back into this entry, and we're going to look at these changes. So we won't be able to look at the 2015 version in terms of differences, but let me know if you come up with questions. But this is very similar to what we currently see already, or we're seeing in the 2015 version. So it's really the change is here. This is where you'll see the biggest change, where previously there was two separate sections. It's now been combined into one. The other change I'll mention quickly here under gender, this pick list is now updated, so it does have this new value. There's no longer an option for other. And now with the housing status, this is still going to be here, but it will flow right into these different possible situations that the client is coming to you from. So you do have your institutional situations, your transitional and permanent housing situations, as well as all of your options to indicate that the client didn't know, or they refused to answer the question, or you never asked the question. I do believe we also used to have an other option under current residents, and we no longer have other as an option here. Okay, so that's under current residence living situation. And length of stay here in previous place. Here you do have that 2 to 6 nights. The 1 month or more, but less than 90 days. The 90 days or more, but less than 1 year. And let me know if that provokes any questions, but you might be seeing some things that are now not quite accurate in your intake forms as we're looking at these changes. These have pretty much stayed the same here, that you still have the same options that we were using previously. A slight wording change here. And now I'm going to scroll down and look at health insurance as well, and just look at that change that we had here. If we go under Add, now we have this box to specify if we use the option of Other, and we also have this Indian health services program, as well as an addition of other as an option here. Okay, so those are the big changes. Does anyone have questions? I am done with the materials that I wanted to make sure to cover. There's nothing else here at the moment that we're going to review, but I want to know if you have questions. We also did update the AMI. Notice that this is now 2016. And you should be seeing this HUD, COC, and ESG entry, SOESSH 2016 Chicago assessment for all projects that are considered under HUD standards to be street outreach, emergency shelter, or safe haven. So if that happens to raise any questions, reach out to us at the help desk. And I'm going to pull over the information to get in touch with us at the help desk. And this is how you can reach us. You have my email here, HMIS@allchicago.org is how you would email the help desk. There's a link to the data standards themselves, as well as the actual help desk as well. And in the event that anyone needs the resources from the help desk sooner than later, I'm going to pull those over just to show them to you. So what we've set up is this HMIS Federal Partners Communications section of our help desk. And there's HMIS data standards as a header here. And then you have the various project types information available. So from the RIE presentation, PATH, anyone that has transitional housing, permanent housing, homeless prevention, rapid rehousing, and this is yours for emergency shelter, safe haven, and street outreach. So this is where the recording will be posted. There is a link here to the data standards, the data manual itself, and there's also a detailed overview here of these data standards with some more text from the data standards themselves. And the PowerPoint slides are posted here, and again, the recording of this presentation will also be posted here. So I thank you all very much for your time, and I hope to hear from you as you have questions on the help desk. I'm going to go ahead and end the presentation. And again, I appreciate you all being here. Thank you.